Borderline personality disorder. Signs, symptoms, and consequences of bipolar disorder, narcissism, and codependency. Written by Lucy Hiltz, John Kirschgen, Gregory Haynes, Victor Higgins, and Taylor Hench. Narrated by Lily Northfield, Sarah Owens, J.A. Lydick, Rory Young, and Sarah Margrave.
Bipolar Disorder: Managing Personality Disorders and Mood Swings Effectively. Written by Lucy Hiltz. Narrated by Lily Northfield. Chapter 1. Meaning and Essence. Bipolar illness, also referred to as manic depression, is a chronically reoccurring condition including moods that swing between the highs of mania and the lows of depression. Anxiety is without a doubt the most prevalent feature of the disease. The manic stage generally includes a mix of irritability, anger, and depression, with or without euphoria. When bliss exists, it could manifest as uncommon energy and overconfidence, playing out in bouts of overspending or promiscuity, to name a few behaviors. The disorder frequently begins in young adult years, but can also happen in children and teenagers. Misdiagnosis is quite common. The condition is usually mistaken for attention deficit hyperactivity disorder, schizophrenia, or borderline disorder. Biological factors most likely develop vulnerability to the condition without certain people and experiences, such as sleep deprivation, can kick off manic episodes. There are two primary types of bipolar disorder, bipolar 1 and bipolar 2. A significant depressive episode might or may not accompany bipolar 1, but does accompany bipolar 2. Many people with bipolar 1 have had at least one manic episode, which might be very extreme and require hospital care. Many people with bipolar 2 generally have a major depressive episode that lasts at the very least 2 weeks together with hypomania, a mania that is mild to moderate and tends not usually require hospital care. What are the signs of bipolar illness? The specifying function of bipolar affective disorder is mania. It can be the activating episode of the disorder, followed by a depressive episode, or it can first manifest after years of depressive episodes. The switch between mania and depression can be abrupt, and moods can oscillate quickly. However, while an episode of mania is what differentiates bipolar disorder from depression, an individual may spend even more time in a miserable state than in a manic or hypomanic one. Hypomania can be misleading. It is usually experienced as a surge in energy that can feel good and even improve efficiency and creative skill. As a result, an individual experiencing it could deny that.
Sample complete. Ready to continue?